First of all, congratulations. Keep going. We're heading down the back side of this now, so hopefully that there's my icon. So you guys are doing a good job. We just need to keep going and continue on the pathway. So today we make a switch. We've been talking a lot about the psychology of working out. We've been talking a lot about the elephant and mindfulness. Now we're going to switch into the principles of training and why the program's set up the way it is. Why when you're doing exercise you want to do it in a systematic, scientific way. So we'll go through some of that today. Of course, as always, we want to remind you that about the mindfulness and just the awareness, which is mindfulness is just defined as the non-judgmental awareness of what is happening at the present moment and being aware of getting clicked into that automatic pilot mode. So when we do that, we're not aware of where we're going, what we're doing. You know, we've talked about it before that people will drive to work and get there and not have any recollection of even driving there. So that's the opposite of mindfulness. And so is this whole thing right now with our world and all the technology in it. I think everything in the world today is actually combating our ability to be mindful and be aware of what's going on. So we just want to draw a lot of attention to that and make sure that people understand that while you're eating, while you're doing exercise, while you're activity, while you're just going about your life, you're more and more focused in on the mindfulness aspect. So just paying attention, self-awareness really is what we're talking about. Because it all does come down to this elephant in the room theory that we have our elephant, which is our emotional side, and then the rider who has to work with the elephant. But they can only work together when the path is clear and when the elephant's been trained. The rider has limited ability and strength, so it needs to use what it has by training the elephant over time and then keeping the elephant on task. Because our end goal is hopefully that we are in total control and are working together with our elephant so that we can accomplish those changes in our lives that we're looking for. So last week we talked about the health report card and giving ourselves grades on our blood pressure, energy levels, blood glucose levels, cholesterol levels. For those of you that were able to come to the health seminar this weekend with the Pathways to Healthy Heart through my nonprofit Health Through Wholeness, you could have gotten all this done there, blood pressures, glucose levels, cholesterol levels. And then we talked about the health age last week too, the simple test that you can do to determine not only we all know our chronological age, but what's our health age on top of that? What effects those 7 habits have. So if you didn't get that, you can actually go to myterrio.com and it should be on there. You can take that quick test to see what's your current health age. And then the fitness score down at the bottom, you should have gotten that when you, well, you should have a couple of them now. That down here that we do, that's the test we do at the clinics to make sure that you are on the appropriate level of program. And we'll talk about, that's what we're going to talk about today, is why that's so important. And then we talked about the grading scale and the importance of that. So we talked about an A is the X, you know, just like back in school, A is excellent, you're within a good range, normal 10%, B's a good, A is excellent, B is good, you're within 20% of ideal or above that 80% mark. C, you're average, you're in that 70% range. And then for our health scores, D is you're below that, those averages by more than 20 or less than 20%, anything over 20%, and we've got that F. So real quick here, let's see how you guys did. So what's your health GPA? Are you on the honor roll? You have a 3.5 out of 4. You got all A's and a B. Is it good that you're in the 3 to 3.49, so you got mostly B's, maybe a combination of A's, B's, and C's. Fair, 2.5 to 2.99, or average, 2.0 to 2.4. So that'd be if you gave yourself a grade for each one and then tabulated your GPA on a 4.0 scale, where would you be? Or obviously the bottom one would be needs improving. We don't want anybody to look at this as in I'm failing. It's just that it's again a mindfulness thing that we know that we need to continue to improve. So I'm going to give everybody a couple minutes to answer that. And let's go ahead and close out of that. And hopefully my screen is back on. So again, the idea there is, and I think we all know that being part of the program, we're all in that trying to improve our outcome level. So as long as you're working on it, that's what's important. And the grade point average right now isn't that vital. What's important is that you continue to work on it and continue to move forward. We talked about that fitness score. So the importance of that is we take that fitness score, when we look at this Fitness 101, there's this idea out there that's been commonly referred to, and everybody's seen it and everybody knows it. It's a saying that got started out of the military and has now like taken hold, and it's the no pain, no gain theory, right? So we always hear this, no pain means you don't get gain. So in other words, you have to be in the painful mode to get any gains. And that's actually not true. That's completely wrong, because pain actually leads to a stampede. Because our elephant, remember, is our emotional side. So the elephant, if it's not used to doing that work, and now all of a sudden you thrust it into this workout where it's getting pain, this no pain, no gain is actually completely wrong, because it leads to demotivation. It also as we look at the principles of conditioning, it breaks the number one principle of conditioning, which is safety. So as with most things in life, safety is vitally important. So we need to make sure that we're following safety. And if we're not, then we're causing pain. Then we got to know that that's too much. So there is, when you know, back to the mindfulness idea, if we're looking at pain that we're trying not to cause, it's any joint pain, or DOMS is delayed onset muscle soreness, which is just pain that occurs and continues to increase for the next couple days after the workout. So, or any swelling around joints, that's on the bad side. Now, that you can and you will experience soreness with exercise. It should always be a mild soreness, and it should be related to the muscles. So more of a stiffness soreness and not getting into the pain. So the first thing we talk about on safety is understanding the difference between chronological age and training age. Chronological age is just simply the number of years we've been on the planet, the number of times we've circled around the sun. Our training age, on the other hand, is the number of years you've been involved in exercise or sports. So we could have two 40-year-old people. One might have done exercise every year since the time they were 5 years old. So their training age would be 35. The other one might have only done PE up until their sophomore year of high school. So their training age would only be about 10. So the importance is you can't do the same program with both of those people. You'd have to do or expect different results because of that simple fact.